Welcome to Clinic Services Best Practices in Practice Management. Today, I'm with Dr. Leslie Capon. Dr. Leslie Capon is an industry leader and dermatology expert and runs 3 practices in Colorado. Clinic Services had the pleasure of working for Dr. Capon for more than 15 years as she has grown and expanded her practice immensely. Today, we'll talk to her about some of the ways she's built her practice and things you might be able to do to grow yours. Thank you for joining us.
Thank you for having me, Andrew.
What are 2 or 3 things that you focused on when you were building your practice?
Good question. It's hard when you come out of medical school to know what to focus on because we're trained to treat the patient, but we're not trained in business. And it's sort of, you have to learn it by hard knocks sometimes. What I've always thought is the most important is if you're honest, you give good patient care, and you're available. And we've been available for our patients 24/7. You're going to build a good practice, you're going to be profitable, and you're going to be able to grow. It's an old-fashioned way, Andrew, but we haven't done a lot of marketing. We've felt by giving excellent to superb patient care and being there for our patients and hiring the best possible staff we can hire that we're going to grow. Patients are going to talk about us by word of mouth, and we would become a successful practice.
Excellent. What advice would you give to either existing practices or new practices in terms of things they can do to help their practices grow and build?
What we have found in growing a practice, once you've started your practice, you need the right management staff. It's very key. If you have the right management staff and the people that you work with on a day-to-day basis to help run your practice, it will make the practice more successful, starting from your practice administrator, to your manager, to your supervisor, and to the people that are ancillary services. For example, the billing company, like Clinic Service Corporation, my accountant that I use, the attorney that we use for employee contracts. That is crucial to the organization. If you don't have a good management staff, you can be the best doctor, you can take care of patients, but you don't have the right people running your practice. I need to know that I can focus my energy on taking care of patients and that my management staff is going to run the practice and that someone like you at Clinic Service is going to do the billing and take us out of that picture. We don't want to do billing. We would rather hire someone that we trust and does a good job to do our billing so we can focus on patients.
Excellent. How has the role of having a healthy cash flow stream made it more possible for you to grow and expand?
A healthy cash flow stream is important, but we don't always have a healthy cash flow. It depends on when insurance companies decide to pay. Most of the time, it's a 30 to 60 to 90 day. Because we're an established practice and we've been around, we have more of a healthy cash flow than a new practice that just comes out. But when we hire a new doctor, Andrew, we have to credential them, we have to pay them a salary, and it takes time for that money to come in. So there is money up front that we have to put out. If we didn't have a healthy cash flow, we wouldn't be able to afford to hire a new doctor or reinvest in infrastructure, which is critical. Our cash flow is healthy most of the years, but there are times in January, February when patients have new deductibles, when the cash flow drops. So we have to get ready for those dry seasons and plan for it, or we would be in trouble.
You and I share a philosophy about having a great company, and great people make a great company. How we treat each other is just as important in what we do, and you just hit on that with your ancillary folks as well as the folks internally. What are some things that you do to promote and build a great culture, and probably the harder part, keep it maintained as you move forward throughout a year?
Excellent question, but probably the most crucial thing in running a business every day. I think it's all about relationships. Everything that I do from my personal life to my business life to my social life is about relationships. Every relationship that I have built through the last 25 years of practice is incredibly important. As we build these long-term relationships, we keep them and they help us grow. Relationships in the practice are crucial if we're going to keep staff long-term. So what we try to do is incentivize our staff, which I would recommend for any doctor that's going out and setting up a new practice, or a doctor that has found they're not as successful as they would like to be. What we do for our staff, we try to salary them in a very competitive way in the market. And then we try to bonus them because we have a medical day spa on sales. And they look forward to those bonuses. As long as the sales are ethical and honest, we do try to incentivize the staff. The third thing that we do is we reward our staff for longevity. We do something that's a little bit creative, Andrew. For our staff that's been here 5 years, we give them a 5-year gift, which is a watch. And we spend, depending on what their salary is, we have different levels that we spend on the watches. Once they've been here 10 years, we give them a cruise for 2 people for 1 week. And for our staff that's been here longer term, 25-year celebration. We just hit the 25-year spot. We took all of our staff, 42 of us went to Vegas for a 3-day weekend, and the corporation paid for 100%. That was the best team building that you can ever imagine. The camaraderie and the relationships that were created during that 3 weekend in Vegas. And it is true, what happens in Vegas stays in Vegas, but actually it's all come back. The emails that I got right when we get back from Vegas last week talked about teamwork, support, and the new relationships that they developed over that weekend. So for me, in summary, it's really all about relationships. Relationship with you at clinic service, the relationship with my staff, be it the providers, the nurse practitioners, the PAs, or the front office receptionists. When we treat each other honestly and with respect, we're going to grow.
Excellent. You've been running a successful practice for 25 years. Obviously, the reward that you just spoke about was an amazing, over-the-top experience. If you were just starting out, day one, as a new dermatologist trying to go out in an entrepreneurial practice, what's the 1 or 2 things you think that person absolutely needs to know? The sage advice you wish somebody would have told you 25 years ago.
I think it's harder now than 25 years ago. I think 25 years ago, I went out sort of bright-eyed and bushy-tailed, thinking I'm going to be a dermatologist, I want to be one of the best in town, and I'm going to work really hard, and I'm going to be successful. And I've been rewarded by Colorado residents, and I've been successful, but I've also given a lot back to the community. And I think what I would recommend to people going out now is very similar to 25 years ago. They have to be more cost conscious now than ever because of the tightening in healthcare reform and the decrease in reimbursement that we've already seen over the years and we're going to continue to see. So the first thing I would say is work hard and be available for your patients. Sort of the old-fashioned, it's not always an 8 to 5 job. You need to take call in the evenings, you need to be available on weekends, you need to do hospital consults, and you need to be involved in your medical community and social networking, which is very different than 25 years ago. So one is work hard, be involved not just with your patients, but with your community. Be it your church and give back to the community, or be something else like the Dumb Friends League or the Max Fund or whatever you happen to believe in, disabilities for children. If you do that, if you work hard and give back to the community and hire, the third thing, the right management staff to help guide that ship, I think that's how you're going to be successful, because you need someone looking at your bottom line. You have to now
And that
be
shouldn't
frugal.
be the doctor?
I don't think it should be the doctor. I find that when the doctor micromanages and is involved in every single aspect of the bills in and out, I think it leads for difficulty in running the everyday practice of your patients. So in the beginning, the doctor has to be involved overseeing. But as far as paying bills and looking at accounts payable and the every day that you need to do as far as the administration or the management of running the practice, I think the doctor from day one should hire a good administrator or practice manager that can help them market the practice, position them in the right location. Where are you going to be? Are you going to be affiliated with a hospital? Are you going to be away from a hospital? And look at their bottom line, why they see patients, spend time with patients, develop their reputation, and not just the medical community, but the community at large. Patients care that doctors are compassionate, honest, and give back. Not just to them, but to the community.
What was the biggest lesson learned that you've had in this past year?
Well, that's a good question, and I'm not sure I have an immediate answer for you. But from a business point of view, I don't know if I've had something I've learned in the last year that's different than the last few years. Because I learn every day from my patients and from my staff. On a personal level, what I've learned the last year is that as much as you love what you do, and I love dermatology and I'm absolutely passionate about it, you can't forget about your family. And your family should always come first. Your spouse, your siblings, your parents, your children. And if you're going to practice and work hard, never let that practice surpass your family, which is your most important relationship.
Dr. Capon, I'd like to thank you for coming in and helping us with our program today. Your insights have been absolutely valuable, and we're hopeful that the people who are watching this get good benefit of the information and the wisdom that Dr. Capon has had to share. So thank you for tuning in to Clinic Services Best Practices in Medical Practice Management. We'll see you next time.